Hello, I'm Dr. Ron Balkasoon. I'm a pulmonologist and contract consultant in Denver. I work at National Jewish Health in Denver, Colorado, and I'm a paid speaker for Synovian Pharmaceuticals. Thank you for joining me for today's presentation, COPD Treatment Focusing on Patient-Centered Care. This promotional non-CME program presented on behalf of Synovian Pharmaceuticals is intended only for U.S. healthcare professionals involved in the treatment of patients with COPD. The information contained herein is intended for general information purposes only. It's not a substitute for your professional medical advice and judgment. According to GOLD, each treatment regimen should be patient-specific. GOLD 2017 states, each pharmacologic treatment regimen should be individualized and guided by severity of symptoms, risk of exacerbations, side effects, comorbidities, drug availability, and cost, and the patient's response, preference, and ability to use various drug delivery devices. Please note that GOLD does not endorse any specific treatments. According to GOLD, each pharmacologic treatment should be individualized and guided by severity of symptoms, risk of exacerbations, side effects, comorbidities, drug availability, and patient's response and preference. Drug delivery method is also important. Effective drug delivery and inhaler technique training is essential for inhaled therapies. Please note that GOLD does not endorse any specific treatments. Patient-specific factors to consider for device selection: patient preference, coordination and patient ability, access, age, peak inspiratory flow, device education. In assessing patients for the most appropriate drug delivery method, let's review some considerations. Can the patient use their current device? Will a caregiver be assisting with administration? After technique assessment, are you adjusting the device accordingly? Are you periodically checking the patient's device technique? Are you matching the device to the patient's preference? Is the medication getting to the target site? Next, we'll take a look at the pros and cons of the four most common inhaled devices used to treat COPD: metered-dose inhalers, or MDIs, dry powdered inhalers, DPIs, soft mist inhalers, SMIs, and nebulizers. Individualization of treatment should be based on symptoms, risk, and clinical history. The metered-dose inhaler, or MDI, is one inhaled therapy delivery option. The MDI consists of a pressurized canister that delivers an aerosol form of the drug. The MDI has pros and cons. It is small and portable and requires a short treatment time, seconds, with no drug preparation and minimal cleaning. However, device actuation is required, and the patient must be able to coordinate breathing and actuation, one coordinated breath, and the device needs to be shaken. Another option is a dry powdered inhaler, or DPI. DPIs can be single-unit dose, multi-unit dose, or multi-dose reservoir. You may want to consider that DPIs are small and portable, are breath actuated, one coordinated breath, require a short administration time, seconds. However, DPIs require moderate to high inspiratory flow, may deliver medicine less optimally to patients with a low peak inspiratory flow rate, PIFR, and have an internal resistance. Peak inspiratory flow rate is the maximal instantaneous flow achieved during a forced inspiratory flow volume maneuver. There are other inhalation parameters in addition to peak inspiratory flow rate that may affect the delivery of medication from a device, including the adequacy of flow at the start of inhalation and the duration of inhalation. DPIs can have an internal resistance which determines the effort patients have to make to achieve adequate inspiratory flows. Next, let's review soft mist inhalers, or SMIs. SMIs are generally multi-dose devices that contain a one-month medication supply. You may want to consider that SMIs are small and portable, allow inhalation of medicine independent of respiratory effort, require minimal cleaning. However, SMIs require device actuation as well as specific breathing techniques, two coordinated breaths. Let's review pros and cons of nebulized therapy. Nebulizers can deliver both short and long-acting therapies. First, let's consider the pros of nebulizers. Treatment is delivered with regular tidal breathing, several breaths over time. Nebulizers allow inhalation of medicine independent of inspiratory effort. No hand-breath coordination, deep breaths, or breath holding are required. However, nebulizers require multiple steps for setup and cleaning, can take up to 20 minutes for administration, and can vary in size and portability. This concludes our discussion about COPD treatment considerations and the most common inhaled therapies. Thank you very much for your time.